languages Indonesian, Dongwon, and English.
Di Sinchong School banyak kegiatan untuk meningkatkan keterampilan dan kepercayaan diri seorang anak.
我长大了，我会穿裤子。你爱我，我也爱你。Languages Indonesian, Dongwon, and English.
Sinchong School tidak hanya membuat anak bisa akademis, tetapi juga
kepercayaan diri seorang anak.
When I grow up, I want to be a professional chef.
大家好，我是信中善语学校3、4班的小朋友，我有一个好听的中文名字叫黄仁义，我特别喜欢学习中文。今天我要给大家演唱一首中文歌曲《我爱我的家人》。妈妈爱爬山，爸爸爱种花，哥哥爱画画，我爱小鸭，爱学着爱玩耍。我爱我的家人，我爱我的老师，我最爱新中善语学校。谢谢大家。
Hai, saya Ranto dari Iten. Kesan saya untuk Sinchong School, menurut saya Sinchong School memiliki lingkungan yang baik untuk anak belajar. Saya melihat banyaknya perkembangan dari Iten selama bersekolah, baik dari segi akademis maupun non-akademis, terutama dalam berbahasa. Semua ini tidak lain karena kerja keras dari para guru dalam proses pembelajaran. Terutama dalam masa pandemi ini, usaha-usaha yang telah dilakukan oleh para guru wajib kita apresiasikan. Semoga pandemi ini cepat berlalu dan anak-anak dapat cepat kembali bersekolah seperti biasa. Terima kasih.
KBTK Sinchong mempersiapkan putra-putri Anda menjadi para pemimpin Asia masa depan.
Silakan mengakses website Sinchong School di sinchong.sch.id
atau melalui Instagram Sinchong di @sinchong.school.
Sinchong 三语学校，欢迎您。
Good afternoon, parents of Sinchong Playgroup Kindergarten and Primary. Welcome to Health Talk with the Expert Series hosted by Sinchong School in partnership with Hope Medilink, Overseas Hospital Information Center. The speaker for today is Dr. Cheryl Ngo from Singapore. I am Miss Afi.
And I am Miss Debbie, your host for today. Today is the best time for us to enrich our knowledge about the importance of keeping our eyes healthy during this online learning. It's nice to see the great enthusiasm of the parents here.
Ladies and gentlemen, before we begin the webinar today, Sinchong Principal will give a speech for all of us. Please welcome Ms. Berta.
Good afternoon, parents, our beloved teachers, and Miss Yura as the principal of Sinchong Kindergarten, Bu Indah and Pak Pius from Hope Foundation. Welcome to our webinar, Healthy Eyes, Solid Foundation for Online Learning. Thank you for your time to join our webinar this afternoon. We would like to welcome Dr. Cheryl Ngo from Adult and Child Eye Clinic in Mount Elizabeth Novena Hospital, Singapore. Thank you for your time and sharing to us. It's a privilege for us to be here and hear your sharing. We believe that this webinar will be a valuable sharing for us in educating our children. Dear respected parents, we know that our life has changed in the past 1 year because of the COVID-19 pandemic. One of the changes that we have to face is in how our children study. All of us are forced to do online learning that makes our children spend more times in front of screen, and it will affect the eye health of our children. We are so grateful this afternoon. We have the opportunity to join a special webinar by Dr. Cheryl Ngo, who is the eye health specialist from Mount Elizabeth Novena Hospital in Singapore. We believe that through this webinar, we can learn something and apply it during online learning. Once again, thank you so much for your time and enjoy our webinar. Good afternoon.
Thank you for the speech, Ms. Berta. And now it's time for Hope Medaling to present about their programs.
Terima kasih atas waktu yang diberikan untuk Hope Medaling. Selamat siang orang tua murid semuanya. Selamat siang para peserta webinar siang hari ini. Perkenalkan, saya Pius Yunianto dari Hope Medaling. Bapak Ibu, saya mengucapkan terima kasih siang hari ini kepada Sinsong School, di mana Sinsong School sudah menjadi partner kita untuk melakukan webinar pada siang hari ini. Terima kasih juga kepada Dr. Cheryl dari Mount Novena, dokter spesialis mata, yang sudah berkenan memberikan waktu buat kita untuk nanti men-sharingkan pengetahuan tentang mata yang semoga berguna bagi kita semua. Dan perlu diketahui, Dr. Cheryl ini Bapak Ibu, sebelum beliau bekerja di Mount Novena, beliau adalah Kepala Departemen untuk Mata dan Anak di National University Hospital. Dan saat ini Dr. Cheryl masih menjadi visiting consultant di NUH juga dan mengajar di Fakultas Kedokteran Nasional University Singapura, Bapak Ibu. Semoga acara siang ini berguna bagi kita semua dan tetap kita menjaga protokol kesehatan, memakai masker, mencuci tangan, dan selalu menjaga jarak. Sekali lagi, terima kasih atas kesempatan yang cukup berbahagia ini. Semoga acara ini bisa berjalan dengan lancar. Waktu saya kembalikan.
Thank you, Hope Medaling, for sharing with us. Without further ado, let me introduce you to our moderator for today's webinar, Mr. The time is yours.
Oke, thank you Miss Alfi. Oke, saya bahasa Indonesia aja ya. Oke, ya selamat siang Bapak dan Ibu dan rekan-rekan sekalian ya. Senang sekali kami atas partisipasi dan antusiasme Ibu-ibu, Bapak dan Ibu sekalian untuk mengikuti webinar kami pada hari ini. Ya, sebelum kami mulai sharing dari pembicara hari ini, saya akan bacakan sedikit profil singkat dari Dr. Cheryl Ngo ya. Tadi sudah Pak Pius sudah sampaikan, ini akan saya tambahkan sedikit saja. Oke. Ya, nama lengkap beliau adalah Dr. Cheryl Ngo Shuven. Ya, beliau adalah spesialis mata di bidang ophthalmologi di Adult and Child Eye Clinic Mount Elizabeth Novena Specialist Center di Singapura. Oke, beliau juga anggota dari American Association for Pediatric Ophthalmology and Strabismus sejak tahun 2016. Selain itu, beliau juga banyak melakukan riset dan membuat jurnal yang sudah dipublikasikan yang mencakup myopia, strabismus, dan katarak. Dr. Cheryl juga pernah mendapatkan penghargaan The Academic Medicine Development Award FY di tahun 2013. Ya, selain itu masih banyak lagi informasi menarik dari beliau yang kalau saya bacakan semua bisa habis 1 jam Bapak Ibu. Oke, maka dari itu sekian perkenalan singkat dari Dr. Ngo. Mari kita sambut dengan tepuk tangan meriah. Ladies and gentlemen, please welcome Dr. Cheryl Ngo Shuven.
Let's give big round of applause for Dr. Ngo. Ni hao.
everybody for being here today. So I'm just going to share my screen. Let me know if you can see that. One
Coba itu. Belum ngomong dia.
All right, I hope everybody can see my screen, yes? Okay, thank you. So today I'm going to talk about some of the very common eye problems that happen in children. And along the way, Mr. Ridwan will help me to do the translation. So I'll be happy to answer any questions at the end of this presentation as well. So generally for children, their eye problems can be divided into 3 big groups, whether they have red eyes, strabismus or squint, or refractive errors or spectacle problems. And in red eyes, it's mainly caused by, can be conjunctivitis or a more severe form of allergy or inflammation or infection called cellulitis. Mr. Ridwan?
Oke, Bapak Ibu, jadi untuk hari ini ada 3 masalah besar dalam masalah mata pada anak. Yang pertama itu kita ada mata merah, kemudian kita ada kondisi di mana anak-anak terjadinya penyempitan pada mata, dan juga yang terakhir adalah di mana ini sangat umum terjadi, yaitu seperti mata tidak bisa melihat secara jelas. Kemudian juga ada di sini ada namanya pink eye atau mata merah seperti itu. Kemudian ada juga infeksi yang disebut dengan cellulitis.
So first we go through red eyes in children. So the most common cause of red eyes in children is usually conjunctivitis, which can be either due to an infection or due to an allergy. So if it's due to infection, most commonly it's a viral infection, whereby the children may have runny nose, a little bit of cough, and then sometimes if you feel before their ear, they get this enlarged, what we call lymph node, that you can feel a lump before their ears. Then usually the discharge is very watery, very stringy, and they may have a little fever associated as well.
Gejala pertama yaitu konjungtivitis, di mana ini biasanya terjadi karena infeksi dan juga alergi. Dan di sini juga biasanya terjadi sebagai gejala, yaitu adanya matanya berair, kemudian adanya cairan yang seperti bernanah, dan juga adanya kotoran pada mata.
So if it's a bacterial infection, usually the discharge is thicker and more yellow.
Oke. Biasanya ini terjadi karena adanya bakteri pada mata.
So allergic kind of conjunctivitis is also very common. Usually the children complain that their eyes are very itchy. They may rub their eyes quite a lot, and they may have other history of allergies elsewhere, such as sensitive skin, sensitive nose, or even asthma. And when we check on their eyelids, they have these what we call papillae when we flip the eyelids around.
Kemudian ada juga gejala alergi di mana di sini adanya histori karena asma, kemudian eksema, dan juga alergi pada bagian rhinitis. Kemudian adanya papila atau pada kelopak mata yang bengkok seperti pada gambar.
So usually what we give to conjunctivitis is that usually we get tears. We teach them not to rub their eyes and to wash their hands frequently if they do touch their eye. We do give antibiotics if it's due to a bacterial infection, or if it's due to allergy, we do advise the children to put like a cold towel on their eye. Don't let them rub their eyes, And sometimes we give them eye drops to help with the allergy, such as Chromobac, Patanol, or even Lastacaf.
Salah satu cara menanganinya dari simptom yang sudah kita jelaskan yaitu pertama bisa menggunakan hand hygiene, kemudian adanya obat tetes mata. Kemudian untuk infeksi dalam yang disebabkan oleh bakteri itu bisa menggunakan antibiotik seperti tobramycin, chlorphenol. Kemudian untuk alergi bisa dipakai obat seperti Chromobac, Patanol, Lastacaf.
Another very common cause of red eye in children is chalazion, or some people call it sty, where you can see this very red bumps on the eyelid. It can start small, but it can become very big as well. So what we advise if at home you start to see this on your children, importantly, we can actually treat it at home first. So first wash your hands with soap and water. You can dilute a little bit of baby shampoo, clean the eyelid, or it's even possible to use store-bought lid wipes. And then after that, put a warm towel over the eye for 5 to 10 minutes. Do a gentle massage over the bump to see whether it can remove the excessive oil and if the pus can be discharged by themselves. However, if this doesn't work and it gets very big, sometimes the children need a little procedure to drain out the pus and to treat the infection.
Kemudian untuk seperti pada gambar yaitu adalah yang namanya chalazion. Chalazion itu seperti benjolan kecil. Biasanya tidak nyeri dan itu adalah bengkak yang muncul pada kelopak mata. Dan di sini penanganannya bisa untuk pertama kalinya bisa dicuci menggunakan air sabun seperti itu. Kemudian maksudnya cuci tangan terlebih dahulu menggunakan air sabun. Kemudian bisa menggunakan di sini adalah eye drop seperti itu. Kemudian bisa menggunakan cotton buds untuk membersihkan chalazion tadi. Dan yang terakhir adalah bisa menggunakan air hangat seperti di perkiraan 36 sampai 40 derajat Celcius seperti itu. Dan biasanya untuk kasus yang lebih parah harus mendapatkan penanganan yang lebih serius dari dokter mata.
So cellulitis is a more severe form of infection or inflammation whereby it's an emergency, and usually the child is quite sick with fever, and most common cause is an infection that spreads from the sinus, or they may have history of chalazion where they had trauma or even previous surgery in the eye.
Kemudian kita punya namanya cellulitis, itu adalah infeksi pada lapisan tisu di sekitaran mata, dan di sini bisa disebabkan karena adanya infeksi lemak atau otot yang kandung di dalam tulang mata. Di sini juga sinusitis adalah faktor yang paling umum dalam cellulitis.
So usually this is a CT scan. As you can see that usually here the sinus is infected and sometimes there's an abscess, which is a collection of pus near the eye. So usually for these children, we need to admit them to the hospital, and then we don't give them any food and drinks in case they may need surgery. And then we start them on antibiotics. And then if it's still not getting better, sometimes we need to do a surgery to drain the pus out, especially if it's signs showing that the eye nerve is being compressed.
Pada beberapa kasus sinusitis, biasanya langsung dibawa ke rumah sakit terdekat, seperti pemberian antibiotik dan semacamnya. Dan untuk kasus yang lebih gawat, biasanya akan adanya penanganan yang lebih lanjut dari dokter mata.
So the next one I'd like to talk about is strabismus or squint, as well as myopia, or also known as lazy eye. So in a baby, when they are born, usually their vision is not very good. And in order for them to develop good vision, they must have clear image on their retina in both eyes, must be equally clear, and they should not have squint or strabismus, If not, this can lead to a lazy eye or amblyopia.
Oke, di sini ada visual development-nya. Biasanya untuk bayi yang baru lahir mempunyai penglihatan yang buruk. Kemudian juga adanya visual development seperti
sorry, mungkin bisa saya bantu.
Oh ya, silakan.
Strabismus itu mata juling. Jadi ya bahasa Indonesianya. Jadi dia matanya berbeda antara kiri dan kanan. Kemudian itu juga bisa mengakibatkan lazy eyes juga. Okay.
Thank you, Miss.
So I'm going to show you a little video now on what is strabismus and what are the different kinds of strabismus. Maybe you can understand a little bit better.
Oke, bisa dilihat di sini ada video strabismus.
Strabismus or a squint is when the eyes are not aligned. So maybe it may turn in, so-called esotropia. Sometimes it goes out. It's called exotropia. Sometimes the eye goes up. We call it hypertropia. Sometimes the eye goes down. We call it hypotropia. Sometimes the eyes can be rotated. We call it cyclotropia. So the strabismus can be there all the time, sometimes there, sometimes not there. One eye, both eyes, or alternating. So there are many different causes of strabismus. The most common is weak eye muscles. But we have to be careful. It's urgent. If it's sudden onset, the child complains of double vision, or the child doesn't seem to be very normal. And strabismus can be treated either by exercises. Some types of strabismus, you can do eye drops. Eye patching if necessary. Glasses. And surgery if the glasses or the patching do not work. So sometimes strabismus surgery is needed if the eye is misaligned half the time or more. And there's an 80% chance that after surgery, the eyes will become perfectly aligned. So usually after the surgery, the eye will be red and slightly sore. But there will be no eye patches required after surgery. And usually after the surgery, the child needs to keep the eye clean, put the eye drops, but she can return to school or work. But surgery doesn't take away the need to wear glasses, so the child would still need to wear glasses as expected. So once again, how do we manage strabismus or squint? If necessary, the child will be prescribed with glasses. If there is a lazy eye, the child may need to put patches, or penalization means to put eye drop into the eye that is stronger to blur the vision, so the child would use the weaker eye more. Some types of strabismus, you can do exercises. If the child complains of double vision or diplopia, we can give prisms. And we do consider surgery in order to get rid of the double vision if the child is tilting the head to one position, or just to make sure that the child's eyes looks better.
Ini adalah cara penanganan untuk mata juling atau strabismus. Yang pertama bisa memakai kacamata jika diperlukan. Kemudian untuk merawat lazy eye itu bisa menggunakan patch atau penutup mata. Kemudian adanya exercises seperti eye exercises seperti yang ada di dalam video. Kemudian lensa prism untuk diplopia, dan jika memang sangat diperlukan adanya operasi pada mata.
So now we come to a very big part of children eye problems that we see very often. We call it refractive errors. or means spectacle power. So I'm going to share one more video on what are the different types of spectacle power so that maybe everybody will understand. So there is a difference between myopia, astigmatism, hypermetropia, and presbyopia.
Oke, dan ini ada video untuk myopia. Itu juga salah satu gejala pada mata.
In the eye, there are a few things that contribute to refractive error: the natural lens and cornea of the eye, as well as the length of the eyeball. So in myopia, what happens is that near is clear but blur at the distance. So in a child with myopia, the cornea and the lens is steep and the eyeball length is long. So in myopia, what happens is that the light rays do not focus properly on the back of the eye. Therefore, there is a blurry image. So when you put the corrective lens, the light rays can then focus properly on the back of the eye, so you get clear vision. So hyperopia is a little bit like the opposite of myopia, where distance is clear but near is blurred. So in hyperopia, the cornea and lens is flat and the eyeball length is actually shorter than usual. So in hyperopia, the light rays, again, they focus at the back of the eye. So on the eye itself, you get a blurry image. But if you correct the lens with a plus lens, the light rays focus accurately on the back of the eye, and then you get clear vision. So astigmatism or cylinder is also known as sangkwang. It's because of irregular curvature of the cornea or the lens. So vision is blurry. And so usually the cornea or the lens is like a basketball, nice and round. But if it's shaped like a rugby ball, you get an irregularly curved lens surface or cornea surface. So this is presbyopia or 老花眼. It's different from hyperopia. You need plus lens, but it's nothing to do with the length of the eyeball. Instead, the muscles that control the lens become stiff. Therefore, the difficulty is focusing at near. So we can correct with spectacles, contact lenses, or in adults, refractive laser surgery. Okay. So now, I think it's a very important part. I've just learned that in Surabaya, all the children are still doing online learning. So everybody has increased screen time. And so I'm sure all parents are very worried about worsening eyesight. And some of the danger signs that parents should look out for is if your children tend to go very close to the screen to look, They tend to narrow their eyes or maybe even tilt their head when they're looking at the screen. And I think a question that we should all ask is, how much screen time do we allow our children? So let's learn about some tips on good eye care habits in order to protect our children. So impact of COVID-19. In Singapore also, we had home-based learning last year for a period of 2 months where the children could not go to school. And I think similarly in Surabaya, schools have implemented video conferencing platforms such as Zoom or Google Meets to engage children in live sessions. And perhaps all the lessons, homework, and even exams are done on an online platform. Therefore, now all the children have an increase in near work activity. They do a lot of reading, writing, and screen time, and do not go out as often because they are worried about catching COVID outside. And this is very challenging for parents, especially those who are working from home, because now they have to do their work, they have to manage their children, and what can they do if they do not show the children the screen? What other kind of screen-free entertainment can parents give their children? So generally, that families are confined with their home. The problems with excessive screen time, besides the eye, is that children tend to become obese. They tend to have poor quality sleep if they have too much screen time. Of course, we know it causes strain on the eyes, and this all can lead to educational and behavioral problems. And apparently, this is associated with a reduction in other activities. They do not go out to play with other people, they do not socialize, and these are very important for children's learning and development.
Excuse me, Dr. Cheryl.
Yes.
Maybe let Mr. Ridwan translate first for a while. Yeah, thank you.
Oke, jadi seperti yang kita tahu bahwa di masa pandemik ini kita banyak menghabiskan waktu kita di depan layar, terutama untuk anak-anak seperti sekolah dan semacamnya. Dan di sini kita akan mencari tahu bagaimana kita mengurangi screen time atau bagaimana kita mengurangi waktu di depan layar seperti itu. Dan seperti yang kita tahu juga di sini screen time untuk anak-anak juga bisa menyebabkan beberapa masalah seperti obesitas, kemudian adanya buruknya kualitas tidur, kemudian kelelahan mata, dan bisa juga menjadi masalah untuk edukasi dan juga tingkah laku anak-anak.
So American Academy of Pediatrics had previously suggested these screen time limits. So children under 18 months should not have any screen time other than video chatting. 18 months to 2 years, they can watch high quality program or apps, but if the parents watch or play with them to help them to understand what they are actually watching. Children aged 2 to 5 shouldn't have more than 1 hour of screen time, again with parents watching or playing with them. And those who are 6 years and older should have limits on the time they spend, regardless of what they are using, whether it's TV, computer, iPad. Mr. Ridwan? Yeah.
Oke. Ya, berdasarkan American Academy of Pediatrics, mereka menyarankan beberapa hal di sini untuk mengurangi screen time. Yang pertama, itu untuk anak-anak di bawah 18 bulan seharusnya tidak melakukan screen time sama sekali. Jadi avoid screen time, kecuali untuk video chatting seperti itu. Nah, untuk anak-anak yang berumur 18 bulan sampai 2 tahun, bisa menonton atau menggunakan high quality programs yang tentunya diawasi oleh orang tua. Di mana peran orang tua sangat penting untuk mengawasi dan juga membantu mereka dalam apa yang mereka tonton. Dan untuk yang umur 2-5 tahun, seharusnya tidak lebih dari 1 jam per hari untuk screen time. Dan di sini lebih dianjurkan untuk adanya seperti quality time dengan keluarga atau dengan bermain dengan ayah dan ibu di rumah seperti itu.
So the problems with increased screen time in the eye is that because if they spend a lot of time on the screen, they tend to spend less time outdoors. And outdoor time is one of the main determinant whether or not they develop myopia or makes their myopia worse. So we found that the more time they spend on near work activities increases the chance of myopia, and the chance of getting myopia increases 2% for every hour of near work done every week.
Oke, untuk masalah mata, ketika screen time itu meningkat, maka di sini salah satu caranya adalah, terutama untuk mengurangi myopia itu rabun jauh ya. Di sini salah satu caranya adalah outdoor time seperti itu. Dan lebih ditingkatkan waktunya untuk anak-anak menghabiskan waktu mereka di luar, di mana di sini kita memang mencegah rabun jauh itu lebih parah seperti itu. Kemudian juga lebih banyak menghabiskan waktu, menghabiskan waktu yang berhubungan dengan screen time itu bisa menambah kesempatan atau menambah menambah kesempatan untuk bisa menjadi rabun jauh sekitar 2% per 1 jam gitu.
So you can see that if we look at the worldwide map, everybody has an increase in myopia, but more specifically in Asia, Asia has very high rate of myopia, and you can see that in Taiwan, Singapore, Hong Kong, and South Korea, the estimated myopia rate just seems to be increasing, and children are starting to become myopic at an earlier age as well.
Berdasarkan data yang ada di sini, memang Asia adalah salah satu yang tertinggi dalam pengidap rabun jauh.
So we worry about having myopia because they can get retinal tear, retinal detachment, and abnormal blood vessels growing in the eye. And also the cost of treating myopia is extremely high. In Singapore, it's estimated to be about $37.5 million.
Yeah. Rabun jauh di sini juga salah satu potensi yang paling besar untuk kebutaan seperti itu, dan di Singapura sendiri itu dana yang sudah dihabiskan untuk manage rabun jauh itu sekitar 37 juta dolar Singapura.
So to understand myopia, firstly we know that myopia is highly heritable. If parents are myopic, it's likely the child will become myopic as well. But also other environmental factors are known to play a role, like the higher the level of education, the higher the cognitive ability, usually the child is more myopic, less time spent outdoors, more urbanization, if the child is born premature, low birth weight, and a higher socioeconomic status are all associated with myopia.
Rabun jauh adalah sesuatu yang bisa diwariskan seperti itu. Jadi bisa karena faktor keturunan juga. Dan di sini adalah lingkungan merupakan salah satu kunci yang bisa membantu untuk mengurangi rabun jauh, seperti tingkat edukasi, kemampuan kognitif, dan juga di sini adalah waktu yang dihabiskan di luar rumah seperti itu. Kemudian adanya social economic status juga, kemudian adanya faktor prakelahiran.
So how do we slow the progression of myopia? Is time spent outdoors has been consistently shown to help to prevent the onset as well as the progression of myopia, and less time on computer games, handheld games, handphone games.
Sekali lagi, untuk mengurangi dampak dari rabun jauh, yaitu menghabiskan waktu yang lebih banyak di selain dari screen time itu tadi, bisa di luar rumah seperti bermain dengan teman di luar rumah seperti itu, atau dengan keluarga seperti pada gambar.
So other ways, some parents are worried about correcting myopia because they think that if they get the glasses and they get the correct degree, it will make the child dependent on the glasses. But we found that if you do not correct the myopia, you undercorrect by 0.75 diopters or more, it actually makes it go faster.
Oke, Miss Indah bisa bantu untuk term ini, undercorrected myopia.
Oh, oke. Sorry ya. I think I missed that. Can you repeat that again, Doc?
If we undercorrect the myopia, we don't give the appropriate glasses, it actually leads to a faster progression of the myopia.
Oke, jadi kalau ukurannya untuk memperbaikinya tidak pas, itu akan lebih mempercepat kemungkinan untuk rabun jauhnya. Minusnya akan lebih cepat banyak bertambah. Intinya itu. Oke.
Most glasses are actually safe, very safe for children to use, very well tolerated. But to prevent myopia progression, there are certain glasses like pinhole glasses, blue light blocking glasses that have no effect on preventing the myopia from progressing.
Oke, jadi sebenarnya kayak blue light blocking glasses itu kayak yang anti radiasi dan sebenarnya itu tidak ada pengaruhnya untuk masalah miopia ini.
Okay. However, atropine eye drops have been shown to be very useful in preventing myopia from getting worse and has been used for more than 40 years.
Oke, mengenai tetes mata itu bisa membantu untuk memperbaiki miopia, percepatan miopia, percepatan minusnya melalui tetes mata.
Namanya atropine.
Ya, namanya atropine.
Yeah.
There are different doses of atropine available. The higher the concentration, the more effective. But if it's higher concentration, they may have more side effects such as glare or difficulty reading. And we cannot stop suddenly because if the high concentration of atropine is suddenly stopped, they may rebound in their myopia. So they require you to stop very slowly and gradually. Then you cannot suddenly run out of medicine and have no more.
Oke, ini adalah dosis penggunaan atropine. Ya, Miss Indah?
Nggak apa-apa, Pak Nadir.
Oke. Ini adalah penggunaan dosis atropine seperti yang bisa dilihat dari grafiknya itu sendiri. Dan ya, bisa dibantu, Miss Indah?
Oke. Untuk dosisnya itu akan lebih baik kalau banyak, tetapi itu pasti ada resikonya, ada side effect-nya. Jadi harus diberikan secara perlahan-lahan sedikit demi sedikit. Kemudian makin lama makin banyak. Ya, continue, Dok.
Okay. So WHO actually recommends atropine eye drop for children aged 6 to 10 years with myopia more than 1 diopter, and if they increase more than 0.5 every year.
So, ini general advice dari WHO mengenai pemberian atropin, tetes mata atropin dosisnya, right?
However, we have to beware because it's an eye drop and a medication. There are still side effects like allergic reaction. Sometimes their pupils become dilated and they need to wear sunglasses outdoors, or sometimes they have difficulty reading. Therefore, they need bifocal or progressive glasses.
Jadi efek samping dari tetes mata ini bisa alergi, bisa pupilsnya yang hitam-hitam itu lebih sensitif. Jadi perlu untuk pakai kacamata hitam kalau keluar ruangan. Kemudian ya bisa mengakibatkan cacat. Kalau cacat di sini maksudnya harus pakai spectacles, pakai kacamata terus.
So there are contact lenses that they also say help to prevent myopia progression. But with any contact lens, we have to be careful of complications such as corneal abrasions and infection. And 3 different types of contact lenses. We find that the normal daily disposable soft contact lens or even rigid gas permeable contact lens are not effective in preventing myopia progression. There is one daytime multifocal contact lens to show the effectiveness about 50%. And the nighttime auto K lens that they wear to sleep is about 30 to 50% effective, but they have the highest risk of infection. And when you stop, sometimes the myopia may rebound again.
Nadir?
Oke, jadi ini adalah cara pencegahan untuk rabun jauh. Bisa menggunakan kontak lens seperti itu, tapi bakal ada resiko komplikasinya seperti pengikisan pada lapisan kornea dan juga infeksi seperti itu. Nah, di sini juga ada beberapa jenis kontak lens yang dianjurkan seperti itu daytime bisa pakai yang seperti ini. Dia sangat baik untuk anak yang lebih maksudnya yang lebih dari 9 tahun seperti itu. Dan ini juga untuk night time-nya seperti ini.
So with any contact lens, especially in young children, we have to be careful of the risk of infection and ulcer, which can ultimately lead to scarring and blindness. And most commonly, contact lens often leads to dry eyes, high risk of abrasion, or even allergic reactions as well. And if we keep pulling on the eyelid when they are very young, after many years, they may get these droopy eyelids or what we call ptosis.
Oke, jadi ini adalah beberapa infeksi mata dari hasil dari corneal ulcer-nya dan itu bisa mengakibatkan kebutaan juga. Dan salah satu gejalanya itu bisa rasa tidak nyaman, kemudian air mata yang berlebihan atau adanya kotoran pada mata, kemudian tingkat kepekaan terhadap cahaya juga meningkat. Kemudian adanya perasaan gatal atau terbakar atau mata terasa berpasir. Kemudian adanya kemerahan pada mata yang tidak biasa, penglihatan kabur, adanya pembengkakan mata dan juga adanya rasa sakit pada mata.
So, to use contact lens safely, they should be certified and properly fitted by an eye care practitioner and not just bought online. Proper cleaning and disinfecting is very, very important. And the child must be mature and ready enough for contact lens use. And usually, we advise maybe wait until the child is a teenager before we start to use contact lens for them.
Oke, jika Bapak Ibu ingin menggunakan contact lens harus dianjurkan pada certified eye care practitioner, jadi tidak bisa sembarangan. Nah, di sini juga diperlukan adanya pembersihan atau disinfecting pada lensa, itu sangat penting. Kemudian pastikan anak yang akan menggunakan lensa itu sudah mengerti atau sudah dewasa atau sudah siap untuk penggunaan kontak lensa seperti itu. Seperti dia juga harus punya kebiasaan perawatan diri yang baik dan juga bisa melaporkan jika ada masalah dalam penggunaan kontak lensa.
So now I'll give some tips on how can we make the best use of screen time during COVID-19 because we cannot run away from screen time. So high quality screen time, such as when the teachers are teaching your child, they will actually benefit your child, allowing them to learn new skill and maybe even do creative problem solving. So we usually suggest use screens together and have screen time together as a family. And encourage your child that they should continue to talk to their friends, such as video call with family, friends, or even have a virtual study session. And balance screen time with other offline activities that can help the child to play, relax, and communicate, such as you can do indoor physical exercises. They can help daddy, mommy with household chores like baking, cooking. You can do craft projects with the children, maybe play board games, listen to audio books, or even just let them play by themselves.
Nah, ini adalah pemanfaatan screen time during COVID-19 seperti sekarang. Yang pertama adalah menonton hal-hal yang lebih bermanfaat untuk anak-anak sehingga mereka bisa belajar skill yang baru, kemudian bisa lebih kreatif dalam problem solving seperti itu. Kemudian bisa menggunakan screen time bersama-sama dengan keluarga, dan tentunya di sini anak-anak juga di-encourage untuk menggunakan screen time jika mereka mau sosialisasi dengan teman mereka. Dan seperti yang kita tahu juga di sekolah sekarang kita pakai Zoom sehingga mereka bisa sosialisasi di situ. Nah, untuk mengimbangi dari screen time itu sendiri, bisa diajak anak-anaknya untuk lebih aktif di luar juga, seperti physical exercise atau membuat kerajinan tangan, bermain board game, atau mendengarkan audiobook seperti itu.
So parents have to be strict and consistently set limits to screen time for children. And there's a 20-20-20 rule, where means every 20 minutes, they should take a break by looking at an object 20 feet away for 20 seconds.
Oke, di sini juga orang tua harus konsisten terhadap anak-anak, di mana di sini ada namanya 20-20 seperti itu. Jadi 20 menit melihat pada screen, 20 menit break, 20 menit melihat 20 menit break, 20 menit screen
Lihat
time.
screen, ya.
Ya.
20
Kemudian
menit keluar.
2 menit keluar seperti itu.
Also, they should have a adequate distance between the screen and the child, at least 60 centimeters when using computer and 30 centimeters when using phone or tablet. And also when they are doing reading, also always have to make sure there's good light, and also or encourage them to take breaks by looking at something far away or at nearby greenery.
Pastikan juga jaraknya diatur, seperti kalau misalnya komputer itu minimum 60 cm, kalau untuk handphone itu minimum 30 cm seperti itu. Dan untuk pencahayaan juga sangat penting, dan pastikan anak-anak mendapatkan pencahayaan cukup dari gadget yang mereka pakai untuk screen time.
So maybe when teachers as well, when they are doing Zoom teaching with the children, maybe we need to get remind children to take a break and say after 20-30 minutes, we should put this as a gentle reminder for the children.
Oke, ini juga buat untuk para guru bisa dipakai untuk reminder seperti ini.
So generally, all children should encourage them to spend time outdoors safely with good sun protection. Don't let them undercorrect the myopia. And all the children with myopia should have regular eye examination. And generally for me, if I have children who come to me with increasing myopia, I either start them on atropine eye drops, or even certain children who are more mature, they can consider progressive contact lenses as well.
Nah, ini untuk pasien untuk yang pengidap rabun jauh itu bisa, yang pertama untuk anak-anak tentunya menghabiskan waktu lebih banyak di luar rumah, tapi berhati-hati dengan cahaya matahari juga. Jadi mungkin bisa dikasih proteksi. Kemudian jangan salah treat untuk rabun jauh, dan di sini juga untuk pengidap rabun jauh harus melakukan pemeriksaan yang lebih teratur.
Thank you, terima kasih.
Thank you.
Okay, thank you, Miss Dr. Cheryl. Okay, let's give a round of applause to Dr. Cheryl for the amazing sharing. Thank you very much. Okay, Bapak Ibu, ya ini kita akan memasuki sesi tanya jawab. Ya, saya sudah merangkum beberapa pertanyaan yang akan saya sampaikan ke dokter. Ya, ini there are so many questions for you, Dr. Cheryl. Okay, I will read you one by one. Tapi sebelum itu mungkin Bapak Ibu kita juga karena terbatasan waktu, mungkin saya tidak bisa bacakan semuanya ya. Oke. This is the first question. So for the children above 6 years old, what's the ideal screen time for them?
Because now they have a lot of online learning, I would suggest, if for school they need to do their learning online, then they have to with parental guidance, they can do the online learning. But besides usual work, they should try to minimize any online activity, such as for entertainment, to watch videos. So if work related, that's okay. But after that, they should not have any more additional screen time.
Jadi untuk screen time-nya itu sendiri dimanfaatkan untuk hal-hal yang lebih penting dibandingkan seperti kayak adanya Zoom School dibandingkan harus menggunakan untuk entertainment seperti itu. Jadi lebih diminimalisasi untuk penggunaan screen time-nya.
Oke, jadi saya rangkum mungkin tidak ada batasan pastinya, yang penting gunakan untuk sesuatu yang positif aja gitu ya. Oke. Oke, pertanyaan selanjutnya, bagaimana cara menghabiskan waktu outdoors sedangkan kondisi COVID-19 masih mengkhawatirkan? Oke, Doctor, there's a question from a parents. You are suggesting that they do outdoor activities more.
Yes.
But however, we are still in pandemic. Pandemic situation. So, how would you handle that?
So right now, if they cannot go outdoors safely, I would suggest at least just look out of the window, look at greenery if possible, just, out of the window as far as possible.
Oke.
Jadi kalau misalnya ragu atau takut mau keluar, bisa melihat-lihat sekeliling rumah, cari yang hijau-hijau seperti pepohonan dan semacamnya. Itu akan lebih menyehatkan mata.
Oke, thank you, Mr. Oke, berapa jarak aman antara layar gadget dengan mata anak? So, what's the distance between children's eye and their gadgets?
So for computer screen, it's usually about 60 centimeters. For phone and tablet, it's 30 centimeters. Generally, we suggest that the bigger the screen, the better, so that they can be further away.
Jarak idealnya untuk komputer itu 60 cm dan untuk smartphone itu 30 meter. Tapi kalau misalnya screen-nya lebih besar itu lebih baik sehingga bisa lebih jauh dari screen-nya.
Oke, thank you. Oke, apakah kacamata anti radiasi cukup efektif untuk mencegah mata minus? Oke, dokter. There's glasses that is called anti-radiation glasses. Is it effective to prevent myopia?
So they are also known as blue light filters. They have been shown to be not effective.
Not effective, ya?
No.
Oh, okay. So.
Oh ya, jadi untuk penggunaan kacamata anti radiasi itu ternyata tidak efektif untuk mencegah mata minus.
So what is the function of that?
So it helps to just relax the eyes by reducing the glare coming from the computer screen, but it doesn't help in preventing myopia or preventing the myopia from progressing.
Itu hanya untuk membuat mata rileks, tapi tidak mengurangi atau membantu untuk mata rabun jauh.
Okay, thank you. Next question. This is a special case, doctor. Ya mungkin Bapak Ibu bisa baca ya, ada di everyone rasanya itu. There's somebody who have problem with their eyelash, the bottom part of the eyelash is coming in. Was it protruding? Yeah, protruding the eyes.
Yes.
The doctor said that he to avoid the lash to scratch the cornea. They have to give an eye drop every day, something like that. Is there any side effect from the eye drop or not?
So the eye drop is actually an artificial tear or a lubricant. It just provides a protective layer between the lashes and the eye itself. But besides that, it doesn't have any side effect. It is actually very safe to use for children.
Oh, okay.
Okay. Jadi obat tetes mata itu sebenarnya sangat aman untuk digunakan karena itu memang air mata buatan seperti itu.
Okay, another question. Is there any special vitamin to maintain the eye health for children?
So there is no special vitamin, and lutein doesn't quite work in children either. What we advise is just a good balanced diet, and best is you can get minerals and vitamins from natural fruits. So berries are actually quite good. So blueberry, blackberry, raspberry, strawberry are generally quite good, but natural sources is better than taking supplements.
Untuk penggunaan vitamin atau suplemen itu sendiri ternyata tidak begitu baik dan lebih disarankan untuk menggunakan hal-hal yang lebih alami seperti buah yang seperti disebutkan tadi adanya blueberry seperti itu.
Okay, so does it mean that the vitamin will not help those who have myopia to be better?
No. Yeah,
No.
it does not help.
Okay. Okay, thank you.
Okay.
Okay. Okay, for children with strabismus, do they have special distance with between eye and the screen?
So basically, any screen time whereby it makes the child very tired, the strabismus will become worse. So the general rule apply, every 20 minutes, take a short eye break, do not have prolonged screen time. If not, usually it makes the strabismus worse.
Oke. Untuk strabismus atau mata juling tadi sebenarnya treatmentnya sama yang rule 20-20-20 itu. 20 screen time, 20 break, 20 melihat keluar seperti itu.
Okay, so it's basically just the same like myopia. So you have to go do activity outside the room also, yeah.
Yes, that's
okay.
right.
Okay, thank you. Okay, another question. Can an older children with strabismus be treated by just using eye patch or must they go for surgery?
So it depends on what type of strabismus they have. So if it's an older child, usually patching doesn't work so much anymore, but sometimes they can do eye exercises or they may need spectacles if they have any spectacle problem as well. So it depends on the type of strabismus.
Jadi tergantung tipe dari strabismus itu sendiri. Ada yang hanya bisa menggunakan kacamata, ada juga yang bisa menggunakan eye exercise yang seperti kita bahas tadi. Jadi itu tergantung pada jenis strabismus.
Okay, is there any special vitamin for strabismus?
No.
Okay,
Same as myopia, no special vitamin.
Tidak ada vitamin untuk strabismus maupun myopia atau rabun jauh.
Oke, ini beberapa pertanyaan saya juga skip ya. Saya sudah yang berhubungan dengan vitamin utamanya ya, Bapak Ibu sekalian, ini tidak, ya sekali lagi ditegaskan tidak ada vitamin khusus untuk mata ya, apapun itu masalahnya ya. Oke. Okay, there's somebody said, is looking at the phone too close can cause strabismus? And how to solve it?
It doesn't cause strabismus, but if the child has a strabismus already, if you always look closely at the phone, it can make the strabismus worse.
Oh, earthquake.
Oh my, sorry.
Earthquake, sorry.
Oh.
Yeah, we are having a slight earthquake in here. Yeah, we're trying to be panicked. Okay. Sorry for the disturbance.
Is it okay?
Oh, still now.
Still shaking. Okay, but just very slight. Okay, we can still feel it. Okay.
Okay.
For this.
Oh dear.
Oh, still going.
I think it's getting better in here in our school.
Gempa.
Oh, okay. No, it's good.
Enggak, gempa ya, Pak ya? Ya, rakyat. Lumayan. Oh yes, saya berbagi.
Okay, I think the earthquake has stopped.
Okay.
Yeah.
Oh,
Okay.
everybody's okay.
Let's continue.
Wow. This is the first time I experienced this.
Something.
Okay, let me continue to read the questions. Oh, yeah, somebody said, is biogland vitamins useful? I think it's the same. Yeah, it's not useful for my prevent my myopia. Okay. Ya, sekali lagi ya Bapak Ibu, untuk yang vitamin tidak terlalu membantu ya istilahnya untuk mencegah myopia ataupun juga masalah-masalah lainnya. Oke. Oke, I heard that there are contact lenses that you wear overnight, so the children don't need to wear glasses during the day. Can it be used for children who already wore glasses -400?
Yes, so they are called auto-K lenses. I think I mentioned just now that yes, they can be used in children who already wore glasses. However, just be aware that this have the highest risk of infection among all contact lens, and the effectiveness is about 50%. And when you stop the use of this auto-K lens, sometimes the myopia jumps even higher.
Okay. Ya, jadi ada lensa yang bisa digunakan namanya I'm sorry, what's the name of the lens? Dr. Cheryl? Optical.
Auto-K, yeah.
Auto-K.
Yeah.
Lensa itu bisa digunakan. Yeah.
Okay. Next, is there any exercise that children can do between screen time?
So I would suggest just either close the eye or just look out of the window, look far away. That's the main thing. There's no special massage or particular exercises you have to do.
Okay.
Jadi tidak ada gerakan yang perlu, maksudnya mungkin sesuatu hal yang simpel seperti menutup mata, menutup mata seperti itu, atau melihat keluar, lihat ke luar jendela seperti itu untuk membuat mata lebih fresh.
Okay. Okay, is there any screen that can reduce the screen radiation from the laptop? And if somebody has already have myopia under -1, should they wear glasses?
If it's myopia under -1, they should wear the glasses mainly if they have difficulty seeing things far away. So they don't have to wear it all the time. So like when you're doing homework, eating, playing, it's not necessary, but maybe for looking at things further away, for use of computer, TV, then it's better to wear the glasses.
Oke. Jadi untuk penggunaan kacamata itu memang silahkan dipakai jika benar-benar diperlukan. Kalau hanya untuk mengerjakan PR semacamnya, itu tidak begitu diperlukan. Hanya untuk ketika memang benar-benar diperlukan menggunakan kacamata, silahkan dipakai.
Oke, last question. Ya, sekali lagi Bapak Ibu, karena keterbatasan waktu, kami tidak bisa membacakan semua pertanyaan. Ya, saya akan bacakan untuk pertanyaan terakhir. Oke. So this is the last question, doctor, okay, because we have limited time also. So for cylindrical eyes, is there anything that we can do to minimize the cylindrical eyes to progress?
Yeah, so very important in children who have cylinder is to avoid eye rubbing, because rubbing of the eyes hard and frequently can make the cylinder worse. Because as you can see, cylinder is because of the shape of the cornea. So if we always rub the eye very hard, the cornea can change shape and make the cylinder worse. So in children with cylinder, generally avoid rubbing the eye. Treat any allergy that the child may have that causes the eyes to be itchy.
Okay. Untuk kasus mata silinder, hindari untuk rubbing atau menggosokkan mata seperti ini karena akan merusak korneanya.
Okay.
Dan itu bisa membuat mata silindernya menjadi lebih buruk.
Okay, thank you, Dr. Cheryl and Mr. Ridwan. Okay.
Thank you
That's
very
all for
much.
the set question Q&A session. Now let's go back to our MC, Miss Afi. Thank you.
Yeah. Okay. Thank you, Dr. Cheryl. Okay, parents, before this webinar comes to an end, let's take pictures together. Okay, come on, parents. Please turn on the camera.
Okay, please turn on your camera. Wow. Give your best smile. All right. Shall we do us your smile? All right. Say cheese. 1, 2, 3. Cheers. Now say ah. Wow. Good job. Wow.
Yes.
Yay. Thank you.
Thank you so much, parents.
Wow, we would like to say thank you to our wonderful speaker for today's webinar, Dr. Cheryl Ngo.
Thank you,
Thank you, Dr. Cheryl. And also to Hope Medaling for the great cooperation. Let's give a big round of applause for us, for them too. It's very meaningful. Hopefully, it will be useful for all of us to support our children's eye health and maintain good eyesight. All right, thank you so much for your time on this Saturday to attend this beneficial webinar. Have a nice day, everyone. Bye.
Bye.
Thank you for today.
Bye.
Bye, everyone. Thank you, Dr. Cheryl. Thank you, Ibu Indah. Thank you, Mr. Ridwan. Thank you, everyone.
Thank you.
Bye-bye. Thank you.
Yes.
Yes.
Bye-bye, Miss Wan.
Bye. Also nice.
Bye.
Johnson.